everyone. Today we are going to talk about the inguinal canal. So let's talk about it. Firstly, we'll talk about the ligaments of the inguinal canal. Here, imagine this is the iliac crest and this is the pubic bone and this is the pubic tubercle. Between the iliac crest and the pubic tubercle, there's a ligament called inguinal ligament, like this. So, from inguinal ligament to the pubic bone, there's another ligament called lacunar ligament. This is it here, extending like this. So, this is the pubic bone. The pubic bone, this part is called as pectineal line. Along the pectineal line, there's a ligament, another ligament called pectineal ligament. So these are the three ligaments. These are located near the inguinal canal. The main ligament is the inguinal ligament, which is participating to made up the inguinal canal. Okay, let's talk about the inguinal canal. This is the inguinal canal. Here it's the inguinal canal. So let's talk about the walls of the inguinal canal. What are the borders? So this is the posterior wall. It's transversalis fascia. You know, in the abdomen wall, behind the transversus abdominis muscle, it's the transversalis fascia. This is it. Transversus abdominis muscle is here, and behind it, it's the transversalis fascia. The deep inguinal ring is in the transversalis fascia. So it's the posterior wall, and after that, this is the lateral walls, transversus abdominis muscles and the internal oblique muscle. These muscles are making the lateral wall, but mainly it's the internal oblique muscle. It's a lateral wall. So what about the superior wall? That means the roof of the canal. It also the same, that transversus abdominis muscle and the internal oblique muscle. It is forming a arch, fibrous arch, as the roof. So this is the medial wall. It's we call it as the conjoint tendon. It is formed by the transversus abdominis muscle and the internal oblique muscles. These muscles are get together here and form the conjoint tendon here. It's the medial wall. And this is the anterior wall. Anterior wall is formed by the aponeurosis of the external oblique muscles. And this is the superficial inguinal ring. And this is the floor, that means the inferior wall of the canal. What's that? Inguinal ligament. So this is the superficial inguinal ring, and this is the deep inguinal ring. Okay, so this is the inguinal canal. The spermatic cord of the males and the round ligament of the uterus in the females is going through this canal. This is the peritoneum, but canal is not going through the peritoneum. And this one is rectus abdominis muscle, and this one is pyramidalis muscle. This is the pubic bone. So this is the inguinal canal. So let's see what's the muscles location according to the inguinal ligament. So imagine this is the iliac crest, and this is the pubic tubercle and the pubic bone. Here is the inguinal ligament. Internal oblique muscle is like this. That means lateral 2/3. It's extending from the lateral 2/3 of the iliac pubic bone or the inguinal ligament, like this. And what about the transversus abdominis muscle? Let's see the ligament. Like this. Lateral 1/3 is the transversus abdominis muscle. So what about the external oblique muscle? You know, external oblique, only the aponeurosis of the external oblique muscle is participating to the making up the canal. So what about that? It is like this. Here it's the iliac crest, and this is the pubic tubercle, inguinal ligament, and so the aponeurosis of the external oblique muscle is like this. You can see the fibers are dividing to two parts in here, and this is a hole. We call it the superficial inguinal ring. So these are fibrous legs, fiber legs. We call it as crus. This is the medial crus and this is the lateral crus. Between these two crus, there are fibers. It's a fiber bundle actually. So this one is called as intercrural fibers. Okay, so this is about the superficial inguinal ring and the anterior wall. So what about the deep inguinal ring? Imagine that as before, this is the iliac crest and pubic tubercle. Imagine that the external oblique aponeurosis and the internal oblique and the transversus abdominis are removed, and there is only the transversalis fascia here, and this is the deep inguinal ring. It's in the middle of the fascia. It's like this. So this is enough about the canal. So what about the clinical features that are relating to the canal? Actually, the main thing is the hernia, like this. There are two parts. There are two hernias. That means direct hernias and indirect hernias. Actually, hernia means the fatty intestinal tissues are coming through the loose connective tissues. There are some connective tissues of the abdomen wall, like this. This is the intestinal tissue, and these are coming through like this, coming through the muscles like this. So this is the direct hernia. Direct hernia means the intestinal tissues are coming through the superficial inguinal ring directly. That means it's not going through the deep inguinal ring. Directly it's coming through the superficial inguinal ring. This is a superficial inguinal ring. First of all, I will tell you that this is the aponeurosis of the external oblique muscle, and this is the transversalis fascia. Imagine that the internal oblique muscle and the transversus abdominis muscles have removed from here. This one is the inguinal triangle. I will tell you about it later. And we call about the direct hernia. Normally direct hernia are affecting to the all people. That means above 40 people are which above 40. So the indirect hernias are normally affecting to the young people. That means below 40. This is the deep inguinal ring, and this is the superficial inguinal ring. Indirect hernias are going through firstly through the direct deep inguinal ring, and after that the superficial inguinal ring, like this. You can see two parts: indirect hernias, direct hernias, indirect hernias, and direct hernias, like this. Okay, so then now we will talk about the inguinal triangle. This is the inguinal triangle. I know that you can't understand this. Firstly, I'll explain it. This is not the anterior posture, this is the posterior posture. Okay, that means now we are looking inside from the inside of the body. Okay, this is not the front side of the body, this is the inside of the body. So that means this is the transversalis fascia, peritoneum has removed, and just imagine like that. This is the transversalis fascia, and this is the deep inguinal ring. This is the pubic tubercle and iliac crest. This is the iliopubic tract. Here you can see the inguinal ligament like this, and here is the lacuna ligament. I told you about that earlier. So You can see this is the external iliac vein, external iliac artery. Between the external iliac vein and the lacunar ligament, there's a hole. It's called as femoral ring. The femoral hernias are going through this. This is not about the inguinal triangle, but that's extra knowledge. So, you know, you can see that there's another branch of this vein, and this artery is going like this. So deep inguinal ring, and here it's the iliopubic tract, and this one is the rectus abdominis muscles. By bordering these things, there's a triangle. You can see there's a triangular structure here. It's called the Inguinal Triangle. Okay, the borders are inferior epigastric vein. These branches are named as inferior epigastric vein and the artery. So border is the inferior epigastric vein, and here iliopubic tract and the rectus abdominis muscle. This is the inguinal triangle. The intestinal stuff, that intestinal tissues are going through this triangle like this to the superficial inguinal ring. This is the direct hernia. Okay, it's over to today. So thank you. Keeping in touch. Bye.